Alright, hey guys, welcome to the lecture on larynx. We're going to split this lecture into two halves, mostly around 20-minute videos. So, the first video is going to cover everything about the anatomy of the cartilages and the ligaments and the joints. And in the second half, we're going to speak about the laryngeal inlet, the laryngeal cavity, the sinus, the ventricle of the larynx, and the muscles of the larynx and the actions that they cause. But I think it's advisable to go through the first one before you directly jump onto the second one, because the second thing is mostly asked as an LAQ for undergraduates. Great. So what you see here is an opera singer going or whatever that is. I'm not a trained opera singer, but what I just did was actually I decreased the distance between my vocal cords. That is, I caused what is known as adduction of the vocal cords, got them closer to the midline to create a high frequency sound. To create a high frequency sound. And if I talk like this, then this is a bass voice. That is achieved by abducting the vocal cords or taking them away from the midline. We're going to be discussing the larynx under the following heads. First, we'll have a nice little introduction. Then we'll discuss about the extent and the average measurements. All the mathematical figures are from the 40th edition of Gray's. Then we're going to speak about the skeleton of the larynx under the subheadings of the cartilages, the joints, the ligaments, and the membranes. Then we're going to be speaking about the cavity of the larynx and its three subdivisions. Then the muscles of the larynx in terms of origin, insertion, action, and nerve supply. Then the blood supply, the lymphatic drainage, the innervation, and the relevant clinical anatomy. So let's begin with the first half of the larynx lecture. Introduction. The larynx is also known as the upper windpipe or the voice box. It primarily acts as an air passage for respiration and also acts as a sphincter to prevent certain stimuli to go inside, which is why it is also known as the watchdog of the larynx. It also kind of helps in what is known as forced expiration, and one of the reasons why we do that is if there's a foreign body inside, then you have to basically create pressure inside and then expulse it outside. That is forced expiration through a closed glottis. That is probably the ideal definition of what coughing is. Then phonation. So phonation is essentially the process of vocalization or speech, and that is something that is most evolved in human beings. So this cannot be like a primary function of the larynx, but it is definitely something that we consider the larynx useful for. Right? Next is fine motor units. Now, this is more of a muscle physiology concept, but you just need to understand that if there is one alpha motor neuron and its axon terminals are distributed over a vast area, then that's called a large motor unit. On the other hand, if it is distributed over a very small area of muscle fibers or myocytes, then that is known as a fine motor unit. So the finer the motor unit, the more precise is its action. So for stuff like movement of the vocal cords, movement of the intrinsic muscles of the hand, I'm speaking about a singer-songwriter for that matter, a person who sings well and plays guitar really well. Not speaking about myself, but has basically fine motor units going to the larynx and the intrinsic muscles of the hand. And the large cortical representation is basically the more fine and precise a movement, the larger is its cortical representation in the cortex. Something that you will study in neuroanatomy, the motor homunculus, etc. So here's a slide of the extent and measurements. You can take a screenshot of that. The larynx is situated in the anterior midline of the neck. It extends from the root of the tongue to the trachea. Its vertebral extent is from the third to the sixth cervical vertebrae. You can add a note on the post-pubertal growth, which is a little more aggressive in males, because of which the thyroid cartilage especially becomes much more prominent and stands out as the Adam's apple. The measurements are given. In sex differences, you can just say that it is much more larger in males with a more prominent Adam's apple. The internal diameter, a factor that is really important for laryngoscopy is 12 millimeters. You can add a note that the larynx is smaller in children. It extends from the first to the fourth cervical vertebra, and at 3 years of age, its internal diameter is about 3 millimeters, and then it increases by 1 millimeter with each passing year until you reach 12 years of age, after which it stays 12 millimeters, right? Let's have a look at the diagram on the right side. You can see all the laryngeal cartilages and its attachments above and below. Let's go from above downwards. You can see the hyoid bone with its smaller and greater corner. You can see a ligament connecting the hyoid to the upper border of the thyroid cartilage, that is known as the thyrohyoid membrane. Let's also quickly talk about the vertebral levels of these structures. So the hyoid is usually present at the level of C3, sometimes between C2 C3. The thyrohyoid membrane can be seen to have a median thickening, that is known as the median thyrohyoid ligament, as well as a lateral thickening that is known as the lateral thyrohyoid ligament. You can also see a small aperture for the passage of the internal laryngeal nerve and superior laryngeal vessels. Then you can see the thyroid cartilage, which is present between the vertebral level of C4 and C5. It has this typical structure, which we'll discuss in detail when we talk about the thyroid cartilage. Then you have a ligament, a membrane connecting the lower border of the thyroid cartilage with the upper border of the cricoid cartilage. Again, that has a central thickening known as the median cricothyroid ligament. We go down, that is the cricoid cartilage. It's an entire ring and it's present at the level of C6. You might as well want to know the other events that take place at C6 vertebra. It's very nice to know these events because it gives you a basic orientation of what lies where. Very important anatomy. Then you've got the cricotracheal ligament connecting the cricoid with the first tracheal ring, and so on and so forth. So we're going to be discussing the skeleton of the larynx under the following 4 subheadings: cartilages, joints, ligaments, and membranes. Let's first talk about the cartilages. Before that, I just want you to have one nice look at the sagittal section of the larynx, where the right half is removed and you're staring at the left half from the right side. This is just going to give you an insight into the inner aspect of the larynx. Once again, you can see half a hyoid bone of the left side that is cut. You can see the attachment of the thyrohyoid ligament to the lower border of the hyoid and to the upper border of the thyroid. You can see half an epiglottis of the left side, and you can see that its lower end is attached to the thyroid cartilage at the median plane by what is known as a thyroepiglottic ligament. That's not difficult to remember, right? Thyroepiglottic ligament. Then you can see a membrane that is extending with an upper free margin that is attached above to the lateral aspect of the epiglottis and below to the arytenoid and the corniculate cartilage. This upper free margin is of the quadrangular membrane, and if you trace the quadrangular membrane downwards, you can see a lower free margin that is forming the upper margin of a slit-like opening, right? That lower free margin is a thickened lower free margin of the quadrangular membrane that is known as the vestibular ligament. It is attached slightly on the paramedian side of the inner surface of the thyroid cartilage. Then you also see another slit, or rather another ligament that forms the lower margin of the slit, and that is the vocal ligament. You can see it stands out a little more prominent with some white color, and that is the vocal ligament. And if you trace the vocal ligament downwards, it is attached to the inner aspect of the upper margin of the cricoid cartilage, and this membrane is known as the cricovocal membrane or the conus elasticus. So you can also say that the upper free margin of the conus elasticus or the cricovocal membrane forms a thickening that is known as the vocal ligament. Please observe the attachments of the vocal ligament too. You can see that it's coming from the tip of a process of the arytenoid cartilage, and this anteriorly protruding tip is known as the vocal process of arytenoid cartilage. and anteriorly it is inserted just below the vestibular ligament in a paramedian plane. Okay, so you can see the inner aspect of the thyroid cartilage. You can see the entire arytenoid. What you're actually looking at is its medial surface, and you can see it perched on the cricoid cartilage, forming what is known as the cricoarytenoid joint, which we shall discuss in detail. Kindly do not confuse the cricovocal membrane with the cricothyroid membrane. Okay, try to understand that the cricothyroid membrane extends from the outer aspect of the upper border of the cricoid cartilage and inserts on the lower border of the thyroid cartilage, while the cricovocal membrane arises from the inner aspect of the upper border of the cricoid cartilage and has a free upper margin that is thickened to form the vocal ligament. Take a moment to understand what I just said. These things are a bit complex. Everything else is pretty simple. You can see the cricotracheal membrane and the first and the second tracheal cartilages, tracheal rings, if you may. Now, the cartilages of the larynx, there are 3 unpaired and 3 paired cartilages. The unpaired ones are the epiglottis, which means resembling a leaf, the thyroid cartilage resembling a shield, and the cricoid cartilage resembling a signet ring. The paired cartilages are the arytenoid cartilage resembling a pyramid and the corniculate and cuneiform cartilages. This is a third view of the larynx as viewed from behind, and I love this one. You can see the posterior surface of the epiglottis. You can see its lower end, also known as the stalk, being connected to the thyroid cartilage via the thyroepiglottic ligament. You can see the inner aspect of the thyroid cartilage. You can see the posterior margin of the thyroid cartilage extending above and downwards as the superior and the inferior cornu. And you can see the posterior surface of the cricoid cartilage and the first tracheal ring. You can also see the posterior aspect of the arytenoid cartilages and the fibrous capsule of the cricoarytenoid joint. Take a moment, take a screenshot if you want. There you go, that's a bigger one. I want you to have these screenshots because most of the undergraduate textbooks you all use don't have beautiful diagrams, and if you don't have beautiful diagrams, you can't understand anatomy. Alright, so epiglottis, it is leaf-like. It has 2 ends and 2 surfaces, upper end and the lower end, also known as the stalk. The 2 surfaces are the anterior surface facing towards the tongue and the posterior surface facing towards the, let's say, laryngeal inlet. You also have a tubercle, and those little holes that you see, they are actually holes for the mucous glands which traverse through and through the substance of the epiglottis. On the right side, I want you to observe this diagram. You can see the posterior 1/3 of the tongue. Then you can see the epiglottis. You can see a small fan-shaped ligament connecting hyoid to the epiglottis, that is known as the hyoepiglottic ligament. Below that you have the pre-epiglottic fat. And there's a couple of other things inside which we shall look into soon. They are actually things that you saw in the previous diagram, but they are now covered with a mucous membrane. So it has that little appearance. Attachments on the epiglottis. Anterior surface, the median glossoepiglottic fold and the 2 lateral glossoepiglottic folds. Like the name suggests, glosso means tongue, epiglottic means to the epiglottis. To see these, you have to look at the left, extreme left diagram and the lower aspect of the slide. You can see the posterior 1/3 of the tongue with all its swellings. These are known as the lingual tonsils, and you can see 3 ridge-like projections. The middle one is the median glossoepiglottic fold, and on either side are the lateral glossoepiglottic folds. Between both of these is a little square cavity that is known as the vallicula. I'm sure you know this if you've studied the tongue. Then the lateral border of the epiglottis, and this is interesting, the lateral border of the epiglottis gives attachment to 2 muscles. One is known as the thyroepiglotticus, which arises from the thyroid cartilage and inserts on the lateral border of the epiglottis. And the second is the areoepiglotticus, which arises from the apex of the arytenoid and goes towards the opposite side. Not really, I'm sorry. It arises from the apex of the arytenoid cartilage and goes towards the same side. Sorry about that. If you want to see those fibers, you can actually see them in the diagram in between. You can see an X-like muscle. That's essentially what is known as the oblique arytenoids, and that goes from the base of one arytenoid to the apex of the other. That's why the confusion. And then you have the upward continuation of that muscle that is known as the arioepiglotticus, that goes from the apex of the arytenoid cartilage to the lateral aspect of the epiglottis, but of the same side. Forgive my mistake. And on the right side is the same diagram that was there in the previous slide, and I just want you to take a moment and try to understand if you can label it on your own. If you observe carefully, it's a sagittal section and only the left half remains. You're seeing it from the right side. So there is a mucus fold connecting the lateral aspect of the epiglottis to the apex of the arytenoid. At the apex of the arytenoid, you have another small cartilage, the corniculate cartilage, and that fold is known as the arioepiglottic fold. Inside that is the fibers of the arioepiglotticus muscle, as well as the upper free margin of the quadrangular membrane. Then you can see that the mucosal fold is all over the arytenoid cartilage, and you can see that the anterior protrusion from the arytenoid cartilage, which is known as the vocal process, is giving rise to the vocal ligament, which is forming the lower margin of the slit. And just above the attachment of the vocal ligament is the other thickening, which is actually the lower free margin of the quadrangular membrane, that is the vestibular ligament. And between the vestibular and the vocal ligament is another deeper pouch that is known as the ventricle of the larynx. I think it's called the sinus. Either way, sorry about that. We'll figure that out. Forgive me. There we go. Same diagram. You can just check it out once again. Check out all these labelings. Take a screenshot. Yes, it's the ventricle of the larynx. I was right. And I think it's also called as the sinus. I don't know. Figure it out. I'm not getting paid for this. Haha. Okay, the thyroid cartilage. Now the thyroid means shield-like, just like the gland. The thyroid cartilage is also known as Adam's apple by non-anatomical people. And the cartilage has a peculiar shape. It's actually formed by the fusion of two quadrilateral laminae. Both these laminae meet in the midline via their medial borders, and where they meet there is a V-shaped notch that is known as the thyroid notch, and this also protrudes slightly anteriorly, forming what is known as the thyroid angle. That is what actually they call the Adam's apple. It is more prominent in males, the angle is 90 degrees. In females it is less prominent, the angle is probably 120 degrees. Now if you look at the lateral aspect of the thyroid cartilage, you also see that the posterior border goes up as a superior horn or a superior cornu, and goes down as an inferior horn or inferior cornu. And just ahead of the posterior border on the lateral aspect, you have the superior and the inferior thyroid tubercles, and they're joined by a ridge that is known as the oblique line. Okay, have a look at the diagram. So each lamina consists of four borders, two surfaces, that is outer and inner, two tubercles, and the oblique line that I've already mentioned. Let's go and have a look at the attachments. But before that, here's a picture of Brad Pitt from the movie Troy holding a shield. Ladies, you're welcome. So, attachments of the thyroid cartilage. So the upper border, that's not rocket science, gives attachment to the thyroid membrane. The lower border gives attachment to the cricothyroid membrane, as well as the straight and oblique heads of the cricothyroid muscle. Now the posterior border is important. It gives attachment to three muscles: the palatopharyngeus that comes from the palate, the salpingopharyngeus that comes from the eustachian tube, and the stylopharyngeus that comes from the styloid process. The oblique line gives attachment to the thyrohyoid and sternohyoid anteriorly, and the thyropharyngeus part of the inferior constrictor posteriorly. In the inner aspect, and this is important, You have the median thyroepiglottic ligament, which should just be called the thyroepiglottic ligament. You already seen that. Then just below that, on either lateral sides, paramedian plane, you have the vestibular ligaments. You've seen them. Just below that, the vocal ligaments. You've seen them as well. And lateral to them, the vocalis muscle, the thyroarytenoid muscle, and the thyroepiglotticus muscle. Just want you all to see the attachments on the right-sided diagram. Sternothyroid, thyrohyoid, and behind on the oblique line, the thyropharyngeus part of inferior constrictor. Okay, let's talk about the cricoid cartilage. The cricoid cartilage is shaped like a signet ring. It is known as the foundation stone of the larynx. It has an anterior arch and a posterior lamina. Both of these have two borders, upper and lower, and two surfaces, outer and inner. And you will also see two facets on the upper aspect of the lamina of the cricoid for the cricoarytenoid joints. You can see that on the left-sided diagram. And you have a facet on the lateral aspect where the lamina and the arch fuse. And that little facet, circular facet, is for the cricothyroid joint. Attachments on the cricoid. So the upper border of the arch gives attachment to the cricothyroid membrane on the outer aspect and the cricovocal membrane on the inner aspect. The anterior aspect of the arch gives attachment to the cricothyroid muscle. You can see that in the lower diagram on the extreme right side. And the lateral aspect, upper border, gives attachment to the lateral cricoarytenoid, which can be seen in the diagram on the left side, lower diagram on the left side, and fibers of the cricopharyngeus part of inferior constrictor, which can be seen on the diagram on the extreme right side below. The lamina of the cricoid cartilage gives attachment on either sides to the posterior cricoarytenoid muscles, and in the center you have a tendon of origin of the longitudinal fibers of the esophagus. Kindly observe the cricothyroid muscle in the diagram above on the right side, straight and oblique heads. Finally, the arytenoid cartilage. It is pyramidal in shape. It has an apex, a base that rests at the articular facet on the lamina of the cricoid, and it has three surfaces: medial, posterior, and anterolateral. And it has two processes: the muscular process that abuts laterally and the vocal process that points out anteriorly. Now you already know that the tip of the vocal process gives attachment to the vocal cords, and the area just above the tip gives attachment to the vestibular ligament. The other two cartilages are the corniculate and the cuneiform. Don't want to speak a lot about them. The corniculate is present at the apex of the arytenoid. The cuneiform is present above that. The corniculate is known as the cartilage of Santorini, and the cuneiform is the cartilage of Risberg. I might have mixed them up, just check that out. They just act as props so that the mucous fold lies perched at a higher level in the inlet of the larynx. Alright, the attachments on the arytenoid. Vocal process, vocal ligament, and just lateral to it is the vocalis muscle. You can see it on the top right diagram. Above the vocal process, the vestibular ligament. The muscular process anterior aspect gives rise to the lateral cricoarytenoid, abbreviated as LCA in the slide. Don't do that in your exam. The posterior aspect of the muscular process gives attachment to the posterior cricoarytenoid muscle. The posterior surface of the arytenoid gives attachment to transverse fibers of the transverse arytenoids that connect one side of the arytenoid to the other. This is not a paired muscle, it's a single muscle that brings both the arytenoids closer to each other. Then, as mentioned earlier, from base of one arytenoid to the apex of the other, you have the oblique arytenoidus muscle, crossing it like an X. We've already seen this. And from the apex These fibers continue within the arioepiglottic fold as the arioepiglotticus muscle. There you go. I just wanted you to have a look at the three different views at the entire cartilages after thyroid is removed. Okay. Same diagram again for the 100th time, I guess. Now, the joints. Now, I really want to do joints right now, but this video seems to have crossed the 20-minute limit. So let's just talk about the joints and the muscles together in the next video, and then we can speak about the laryngeal cavity as well with associated clinical anatomy. Please post in your comments. Let me know how we can make this better. The next video will be also having a 3D app just to give you a better orientation, so I hope that helps. Keep studying, stay safe. Bye bye.